Moving toward instruction now with these same students. What might it look like if kids actually qualify? Because we know there has to be a pretty significant issue or delay, disorder for them to qualify in this area. We're going to be considering their least restrictive environment, even though they may have just had this language assessment and we're considering some pretty specific needs. So if we're considering their least restrictive environment or their LRE, then we're going to look at these questions. And if they answer yes to one out of three of these questions, or you're answering one out of three of these questions as yes, and the problem is getting worse, that language problem is getting worse, that last question at the bottom, then they're most likely going to be a pullout. How we think, that pure, come to intensive speech language therapy for so many times, so many minutes a week. When we ask what, we're thinking of the abilities and challenges of each individual student, their developmental history, of course, their goals that, based on what they were struggling with in their evaluation, and that what the team says through the eligibility process, we're going to determine their goals. We got to remember that. We talk about that a lot at where I work currently as an autism consultant, because it's so easy to view eligibility and assessment as like a separate thing from programming. It is in terms that we need to consider both, but your assessment has to drive your programming. We have to value the information we gather through assessment because that's how we make good goals. So, for instance, I was just saying, I don't always do all those specific language tests, but I tell you, if I went through those global language tests and I thought, I'm still not quite sure what we should target first, I would be doing another evaluation. I'd be doing another test of some kind to keep digging, because what matters is the goal that we create from the eligibility. And we think, who can deliver the instruction? So yeah, maybe it's the SLP, but maybe also it's something that the teacher, that SLP is saying, can you incorporate this as maybe a tier 2 in your room? Because the reality, guys, is the number of speech minutes or language minutes they get is not going to compare to how they're with you all the time. So we want to figure out ways that these strategies and techniques can be incorporated more often than just with their time with the speech language pathologist that they are and pull out. Um, so we know not all, just like I'm saying, not all intensive language instruction would come from the speech therapist. It's like thinking about when you are working with a child that's coming to pull out in a SPED room. We know that not all their intervention, sometimes with these resource kids, maybe hopefully they're not spending most of their day with you, if that's kind of a cross categorical classroom. And so you're doing the same thing. You're working on something, but then you're trying to help that regular education teacher also implement it in their classroom. And that's just what the speech pathologist would be doing in this case. I'm sure by now you've heard of this thing called evidence-based practice. It's a pretty big deal. And so I'm going to let you watch this video on evidence-informed practices, high leverage practices, evidence-based practices, same thing. But we know, like I said, after you do the assessment and you kind of determine goals, it does matter how you choose to address the goal, and it should very much so be evidence-informed. So watch this, and then we'll come back and finish up.